Hi interns, Mrs. Smith here. I asked Stephanie Welch to give you an example of what a video submission would look like. Enjoy.
Hi, my name is Stephanie Welch and I'm a health science studies major from Waco, Texas. So Ms. Smith asked me to go ahead and do an example of what a video presentation would be like for any of you interning and giving a presentation via video. So the following is just a brief overview of what I did for mine. So one of the first questions I'm going to go ahead and talk about is where did I intern and a little bit about the agency. So I had the opportunity to intern at UC Health Steadman Hawkins Clinic in Denver, Colorado, and they are a sports orthopedic clinic that works with both the Denver Broncos and the Rockies sports teams. There are about 20 people in the agency. Some of them were athletic trainers, and then several of them were physical therapists, and they were connected with the Steadman Hawkins Physicians Clinic, so several of the patients were referred from that clinic to our clinic as well. A couple things just more about the agency. So they did have a lot of professional athletes coming in as well as people just from the area, so it was a unique balance of just getting to understand a little bit about respecting all the individuals there and just cueing my attention to whatever was going on with my specific physical therapist. And it was a great opportunity to learn just from really high-end, well-trained physical therapists. The other thing that was really unique about the agency was that they had some cool technology in the back, so that allowed me to get an idea. Because I asked, it allowed me to go and see how they used it for some of their research. So highly encourage you to ask questions. So how I decided on this internship was because I have a strong interest in working with the sports and orthopedic background, and so I wanted to go to a clinic that was affiliated with some professional teams as well as professional ballet companies in the area. So that was something that was very helpful for me about this internship, was that it gave me a great view of what it looked like to be connected with both an orthopedic clinic and a physical therapy clinic that worked heavily with athletes. So as an intern, I basically just shadowed for most of the time that I was in the clinic, but during this time I was able to answer several questions about what my goals and objectives were. So my goals included, one, getting to learn a little bit about the relationship between the physical therapists, the physical therapy assistants, and the athletic trainers in the clinic. Two, to better understand a progression timeline for any injury and when it's proper to progress an individual. 3, to discover the benefits of using different modalities, including cold and hot packs, maybe the ultrasound, and some stimulation units for treating injuries. 4, to learn more about direct access and how it changes the approach to patient treatment. And to learn about the rehabilitation process of an anterior cruciate ligament, since I had seen several rehabs but only in segmented parts. So I really enjoyed my internship experience, and one of the best things for me that I really liked about my role was just that I had the opportunity to ask a lot of questions. I think there are very few times where you get the opportunity to ask a lot of questions and learn a lot, and as a student that's one of them, and people are more than willing to answer your questions if you ask. So it's something I really appreciated, especially about everyone in the clinic. They wanted to know about me and they wanted to know what I was interested in, so this was a great time to just ask questions from people who had a first-hand experience with the role that I was going to step into at some point in my life. As far as my critique and guidelines for future interns, specifically for my clinic, I would just recommend bringing a water bottle, maybe bringing a jacket. It got pretty cold in the clinic, and to just be flexible. A lot of times individuals cancel, and so that's something that you have to adjust to. Another thing I would recommend was, for me, being from Waco, Texas, lacrosse is not a very big sport here. So when I went to Denver, there were several individuals who came in with injuries from lacrosse. So I would recommend maybe looking up something that would be very specific for your clinic or specific to that area that you would see injuries in, just so you had a better understanding, or you knew what questions to ask, or maybe how a rehabilitation procedure would adapt the individual to that exercise more. As far as my impact on the agency, I really wanted to be someone who was helpful while I was interning. So every morning when I got there, I would make sure nothing needed to be done specifically with the physical therapist I was assigned to for the day. And then after that, I would go make ice bags, fill up game readies, do any cleaning from the night before that maybe needed to be done for the next day. And I just wanted to make sure that whatever I did was helpful so that they could focus on their patients, and that I could be another set of hands just assisting around the area so people could really focus on what was important to them. So a typical day for me at the internship started pretty early. So because I was in Denver, I had to deal with Denver rush hour, and that began at 7:30 in the morning. So I usually left my apartment around 7, and I would get to the clinic around 7:30, 7:45, depending on the day. Most of the individuals I worked with didn't start with clients until 8, although the clinic did open at 7 if they wanted. And then whenever I got in, I just said hi to everyone, made sure to greet everyone every day to make it more of a personal experience. And then I would set my stuff down and then go straight over and make ice bags and set those up for the physical therapist to have ready. And I would fill up the game readies just to make sure all the equipment was ready for the day. And if there was any additional cleaning from the day before, I'd be sure to do that just to be able to help them and allow everyone to do their jobs instead of having to be distracted with small tasks. And then after that, I would go to the individualized assignment with. I had 3 different individuals I had the opportunity to work with, which was awesome. So I would rotate throughout each of those every day. And then as far as what it looked like when I was shadowing, basically I sat and I wanted to make sure I had a good balance of when I asked questions and when a question was appropriate, especially if a patient was sitting there. I was allowed to engage with the patients and to talk with them, but I was not allowed to perform any exercises. So a lot of it was conversational, and then I asked a lot of questions because this is a time where you really can learn. So I wanted to ask the physical therapist questions while the patient was there, if it was a question applicable to the patient, and if there was something that I felt was maybe more sensitive, I had to wait until after to ask. And then I would also just ask kind of the why behind they were doing things. So there were a lot of questions that I asked throughout the day. And then on top of that, I also would help set up exercises, and I was allowed to put on ice bags. So really, I just asked what I could do and if I could be helpful in any way, and they were very thankful for that. So my internship did give me a lot of opportunities to learn more about myself as an individual, and especially strengths and weaknesses. So as far as some weaknesses, I realized that time management is hard, especially when I'm getting up early and expected to do a lot for my internship and reflect every day. There was a lot of balance that I had to find with that. So I would say that was a weakness, but I definitely had the opportunity to grow in that and just be more efficient, be more effective, and understand what I needed to do every day. And being disciplined in that was awesome for me. And then as far as strengths, I learned that I do get along well with other people, so I was very encouraged by that. And I learned that for me, I am a huge learner, and that was something that I enjoyed by writing my paper and by getting to ask questions. And I really did get to dive more into the research and the why behind things. So that curiosity for me was something that I really felt like I grew in. As far as how I think I could improve and what I learned from my internship, I think for everyone will probably experience this, but for me specifically, I felt like there was a gap in knowledge between what was going on in the clinic and what was going on in my mind. And so for me, I think it's going to be really important in the future to continue to push myself studying and being disciplined of learning things, not in a massed way, but just over time. That would allow me to really understand the why behind things and better understand maybe the reason for a protocol or even just a muscle that I'm trying to target. For my project, I did a research project on complex regional pain syndrome, which was brought up to me by my supervisor. I asked her, maybe what's something unique or different, especially on the neurology side, because she worked a lot with neurologically deficient patients. And so she introduced complex regional pain syndrome to me, which is severe pain that a patient may experience after pain or trauma or possibly even surgery. And it typically affects the extremities of the body, and it can manifest in several different ways. So something that's really unique about complex regional pain syndrome is that it doesn't manifest the same way in every patient, and oftentimes there's a psychological as well as a physical component to it. So treatment for complex regional pain syndrome is unique that it's tailored to each patient, but there's also not a standard protocol. So for me, my biggest takeaway from this project was if you are to give treatment, the best ways to provide treatment are from research, CO2 baths, which alternate between hot and cold possibly, and mirror therapy, which is where the individual places the affected limb in front of a mirror that's unaffected, so the unaffected limb in front of a mirror, and then they mimic the motions and movements that they want to perform in their affected limb, and that helps them visualize and process mentally what it would be like to have that movement in their other limb. And the biggest thing that I found from all of this was that early intervention is highly important for this to not progress to a severe degree. And so for individuals, it's important for physical therapists to pay attention to see if there are any warning signs of complex regional pain syndrome, as in skin changes, maybe some autonomic arousal that's not typical for a patient who comes into the clinic, and to be able to detect that would be extremely important in the prognosis of the individual. So fortunately, I felt pretty prepared for my internship, especially just because I'd gotten done with some technical classes like anatomy. They were very impressed with my knowledge. So I was encouraged by that. But as far as what I would have liked to have maybe a little bit of help with, one was when I asked for those letters of recommendation, I would have loved to have a resume that was just ready to go, and maybe just some critique on professional communication as far as getting to talk to those individuals, set out the timeline, and just make sure to be a clear communicator. So those are some things that I would have appreciated. So as far as if I were offered a position with this internship agency, I would say absolutely yes. I felt like I was surrounded by such bright individuals, and I was really encouraged to see the extent of the knowledge and the encouragement and the community within the clinic. And as far as what my decision is after my internship, I have decided to stick with physical therapy, and so I'm excited to look for options and attend physical therapy school. And as far as if it did change the direction at all, it maybe did change the direction a little bit for me. So I really enjoyed the personal side of this field, and so I will stick with that. But I also found out how important it was to have a base of knowledge and maybe research, so that's something that I've considered as well moving into the future of looking into internship and research opportunities. Sick 'em Bears!